One second. There was a question posed to Dr. Sherwan Berry. If Dr. Sherwan, are you there?
Yes, I'm here.
Dr. Sherwan. Salam, Dr. Sherwan. The question was from one of the audience members. I have seen many public meetings and events where you can see people shaking hands and not taking social distancing in northeastern Syria. Can more be done to educate people on this issue or implement rules by the self-administration? I think there's something similar to what I asked Dr. Hirsch about what government and people can do to reduce the number of cases. So the question was directed to you, Dr. Sherwan.
What can we do is to encourage people again and to do so as you mentioned. And I think already all the people, or most of the people, are aware of these procedures. But as we didn't face a lot of cases like our brothers in Bashur, Rojhelat, or Bakur, the people feel, and this is unfortunate also, that they are safe somehow and they will not face this problem sooner or later. I totally agree with you. We have to find a way to, let's say, not scaring the people, but encourage them to apply those procedures. But at the very beginning, to be very honest, at the very beginning of this disease, the people were very applying those rules. I mean, the social distancing, washing hands, the not shaking, and so on. But after then, and after the situation was calm and no spreading was happened, this made a negative impact that they felt is safe. Unfortunately, to say this, and maybe if there was cases, they will be again. Unfortunate to say this. It's not only between our people. I mean, it's for all the same. We have Italian volunteers working with us. They are telling the same, that the Italian people were not applying this until they saw the spreading or the outbreak of the disease in all over Italy. Then they started to applying the very strict rules. Unfortunately, before that, they were going out and so on. As I was saying, through the media, we were publishing too much. Kurdish Red Crescent alone, we published almost 500,000 of brochures. The same we are doing now at the borders, and all the TV, radios, I think in all countries they do. We were publishing. What else can we manage to tell or do? I will tell you one other thing maybe related to this. I mean, Rojava is always special in what we have and what we see. In Al-Hol camp, as I was saying, there is almost 10,000 of ISIS families, women and children. We deal with them based on the International Committee of the Red Cross principles and rules. But they are still believing that they can spread this disease within the people here. So they try to do it. They don't care about anything. They say, this disease come from God to help us. So this is very short example. I mean, you cannot compare everyone the same. And somehow the mentality is not the same. You cannot compare our people to German people, for example, who are following the rules with all respect regarding these things, these procedures. We will keep informing and raising this awareness campaign, and hopefully we can manage. I totally agree. There is mistakes. There is people shaking hands, even within the office that I work in, and all supposed to be health workers. Now, because you don't have any case, so shaking hands is always, you can see in front of you, unfortunately, of course.
Zor spas, Dr. Sherwan. That question was by journalist Vladimir, who I understand has a lot of interest in the region. Thank you very much for answering that question. I think as Dr. Herish was finishing, somebody wanted to ask a question. Whoever has their hand raised, if we could.
It was me, actually. Hello. Yes. Hello, everyone.
Hello.
Can you hear me?
Yes. Who's your question for?
All right. So it's for the friend from Rojava, I hope. I have two questions, actually. The first question. Yes. So, the first question is regarding the trust between the authority there and the people. You know, as you know, the stronger let's say the trust is, you know, the more, let's say, protective the people will become. They will protect themselves eventually. Unfortunately, this did not happen here in South. So I wonder, and I want to know whether the people and the authority there do trust each other, and, you know, what's the level of trust between them. And also the other concern is, I think you already mentioned it, but, you know, are people aware of this pandemic? I mean, are they informed, well informed? What about misinformation? Are they sort of directed by, let's say, conspiracy theories, by religious, let's say, I don't know, other factors that may affect their sense of, you know, self-protection and all that? Thank you very much, everyone.
Thank you very much, Mr. Ismail. Dr. Sherwan, if you could kindly answer.
Yeah, I think there is a kind of trust between the people and the self-administration health department, because so far, I mean, self-administration health department, including the health organization that are supporting them, including our organization, because so far we managed well to control it, and big part was luck. This is from my personal point of view. So I think there is this kind of trust. They know the health department doing the best, and there is not this kind of experience that you have in other part of Kurdistan. The self-administration age is just few years, so they don't have this experience to deal with everything. For example, it was suggested by some experts from Spain. They say the health department head of office must every night come to the TV and tell the people, share with them what they have. They were doing so. So any suggested was welcomed by them. They were through the media, and I think this happened everywhere, trying the best to keep the people aware what's happening, what should we do. There is this kind of trust somehow, but we cannot blame the self-administration or the health department here about the situation. As I was saying, mostly half of the medical staff left Rojava, and more than 20 or 30% of the health department infrastructure is destroyed. Not all the health facilities are working totally. So it's not matter of trust. It's matter also of capacity. The people also must understand this and try as best as they can to collaborate with their health department. This is very briefly I can say.
Thank you very much, Dr. Thank you very much, Dr. Sherwan. I think we had a question for Dr. Herish from Umar. He said, when the lockdown in Slemani is still quite patchy, when they first eased the lockdown, they did not put any precaution steps. They first started opening tea shops, restaurants, and other public places, which increased the infection rate. Dr. Herish, do you have any comment to that? Hello. Sorry. For Dr. Herish, we'll just unmute your microphone.
Okay. راستی خوی اما جاری پێشوو لۆکداونەیەکی تەواو کرا لە سلێمانی بەڵام دوای ئەوە کە حاڵەت نەما لە سلێمانی ینی سلێمانی تەواو هیچ کەیسێکی تازەی نیوکەیسیتیان نەبوو لە سلێمانی بۆ ماوەی 2 هەفتە ئیتر ژووری ئۆپەراسیۆنی سلێمانی لۆکداونەکەیان بە شێوەیەکی خێرا سەریع واتە فاستلی لۆکداونەکەیان لا بردووە زۆربەی ئەو شوێنانە ئاسایی کرانەوە کە بەداخەوە بە تایبەتی مزگەوتەکان کافێکان شوێنە قەرەباڵغەکان ناوسەنتەری بازار کە ئەمە هۆکاری سەرەکی جارێکی سەر هەڵدانەوەی ڤایرۆسی کۆرۆنا بوو لە سلێمانی و جگە لەوەش ئەو شوێنانە کە کرانەوەش بەڕاستی مەسلەی خۆپارێزی سێلف پرۆتێکشن پێرسۆنەڵ پرۆتێکشن لەو ئاستەیانە بوو خەڵک پابەندی ڕێنمایی نەبوو و زۆربەی خەڵک ئەتوانم بڵێم ماسک و دەستکێش و شتیان فرێداوای کرد کە تێکەڵاویەکی زۆر جارێکی کە دروست بێتەوە و خەڵک بە شێوەیەکی زۆر نابەرابەر چوونەوە ناویەک و قەرەباڵغی لە زۆربەی شوێنەکان بە تایبەتی لە مزگەوت و کافێ و دوکان و بازار و مۆڵەکانە هەستی پێکرا ئەمە قەینا ئەگەر لەگەڵیاشە پرۆتێکشن هەبووە بەڵام بەداخەوە پرۆتێکشنی لەگەڵا نەبوو بۆیە بووە هۆکاری ئەوەی سەرهەڵدانەوە ئەمە زیاتر پەیوەندی بەوە بوو کە پرسیارەکەی پێشوو کردت ئەم بێمتمانەیی هاوڵاتی بە حکوومەت وای کرد کە جارێکی تر ئەستەم بێ بتوانین لۆکداونێکی لە شێوەی پێشوو بکەینەوە و بتوانین بە تەواوی ڕێنمایی بەسەر هاوڵاتیانە پەخشکەین چکە خۆی هاوڵاتی هیچ متمانەی نەما لە جاری یەکەم بۆیە جاری دووەم بەو شێوازە بە شێواژێکی خێرا و زۆر بە سەریعی سەری هەڵدایەوە.
زۆر سپاس دکتۆر هێرش. I hope that answers your question, Umar, and Oshalay zor spas doctor. Any further questions?
May I have a question, please?
Sorry. Who have we got here?
Abdul Baqi Ahmed, I think. Yeah, Fermo.
Well, thank you very much. I am Abdul Baqi Ahmed, child psychiatrist and associate professor at the Uppsala University in Sweden. And I am active in the Kurdistan region of Iraq, mostly in the Hook, since 1990s. And just now, we are just applying a crisis intervention program for children and adolescents concerning the psychological impact of the crisis on children. I understand that the situation just now is not in the favor of the psychological assessments and to take consideration to the psychological aspects of children, because saving the life is the most important point just now. And also I understand that nobody has been speaking about the children just now because they are general assessments. And thank you very much, of course, to the respectable speakers and to the arrangers of this seminar, Dr. Shuku and Dr. Nasha. Thank you very much for this initiative. I hope that these initiatives will repeat and the next one will be on children. I have a question and a suggestion, actually. My question concerns, as you know, my most concern is about children. Can anybody of you please give us an account, even if it is a little bit, about the numbers, the frequencies of the patients or deaths and the severity of these cases among the figures you just thankfully reported on it? This is my question, if it is possible. The next one is, I have a suggestion. If the ADM will may take the initiative to have this crisis intervention program to be applied in all parts of Kurdistan, because this is a short and cost-effective and time-saving crisis intervention we developed in Kurdistan in Iraq, in Duhok, at the Matin Health House. We have a center there. We call it Matin Health House for Child Mental Health, both for prevention and treatment of mental health problems among children. So we developed in 2014 a crisis intervention program for children and adolescents, and we have been applying it successfully and effectively on children in Duhok, and we have been trying to train even people in the North Kurdistan in Turkey, and also in Slemani and Erbil, and in Sweden. Just now, we are just trying to apply this crisis intervention, SIPCA, it's called SIPCA, in Duhok, and it will be very nice if we are, we have a continuous contact with at least one key person from each part of Kurdistan to have this crisis intervention. They can contact me. I can send to you the manual of SIPCA to the Adam if you give me any email address, and I am going to ask for a key person from each part of Kurdistan to come in contact with me in order to arrange these trainings and to apply this crisis intervention program for children and adolescents, because later also now we know that the psychological impact on children will be very tragic, and will have long-standing consequences on their development and personality. So it will be very good if we start to think about the psychological impact of children. Thank you very much.
Zor spas, Doctor. So to summarize, you wanted to ask the number of cases from your first question of particularly the pediatric cases, or yes, so the number of children who have had COVID in the 4 regions of Kurdistan. باش نازم دكتور هيرش جماعة كاني توجبني كوفيد تيبو مناله كان لخواروي 16 ساڵی.
بەڵێ ئێمە ئەتوانم بڵێم ژمارەی کۆی توشبوون لە سلێمانی بەتایبەت تا ئێستا گەیشتۆتە 6,000 کەس. لەو 6,000 ئەوەی کە ئێمە بە پەرسنتێژ دەرمان هێناوە 13% تقریبا ئەتوانن بڵێم چایلدهودە لەو ئینانە، بەڵام زۆربەی ئەو کەیسانەی کە چایلدهودن بەڕاستی زۆربیان ئەسمتماتیک یاخود ماڵ سمتمیانەیە. تا ئێستا هیچ حاڵەتێکی سڤیر کەیسمان نەبووە لە مناڵ، بۆیە لە 13% کەیسەکانی ئێمە تا ئێستا لە سنووری پارێزگای سلێمانی مناڵن. ئەمە وەکو پەرسنتج لامانە و ژمارەی کۆی گشتی توشبوون نزیکەی ئەوەی کە لای ئێمە ڕیکۆرد کراوە، ئەوانە ناڵێم کە زۆربیان هۆم ئایزۆلیشن کراون، ئەوانەی کە لای ئێمە لە ڕێی پشکنینەکانەوە یاخود لە نەخۆشخانەکان داخل کراون نزیکەی 6,000 کەسە تا ئێستا لە سنووری پارێزگای سلێمانی. بەڵام بە دڵنیاییەوە ئەو ژمارە ئەوەیە کە لای ئێمە لە ڕێگەی لابرۆتەری دایگنۆسس یاخود لە ڕێگەی ئەوەی کە هەنێکی سیتیسکانی بۆ کراوە و یاخود لە ئەدمیشنایە، ئەوانی تر هەمویان زۆربەی زۆریان هۆم ئایزۆلیشنن وەکوتم لە 80 بۆ 85. ئەو کەیسانەی ئێمە مایڵد یاخود ئێسمتماتیک کەیسن، بۆیە ژمارەکە زۆربەی زۆری دیتێکشن نەکراوە یاخود ڕیکۆرد نەکراوە لای ئێمە.
زۆر سپاس دکتۆر. Dr. Sherwan, do you know of any the number of pediatric cases in Rojava of COVID-19?
Yes, it was only one family, 2 kids between 10 and 15 years old, but they had no signs or symptoms. Only after we did the IgG tests, I mean, they were recovered already. we could notice that those kids had from their father, I guess, they were contaminated from him. The only cases we have are 6, so we cannot tell that we have other cases. And as you are aware that most of the kids doesn't developing signs or symptoms like elderly people.
Yeah, thank you very much. Dr. Halis, is he there?
Yes.
The number of cases for pediatric, well, the number of pediatric cases, do you have the figures with you in Bakuri, Kurdistan?
مقابن باکوری کردستان اول ترکیه همو دران اف یعنی چند کیس چگونه چکاس نخوش هنه و تمنی وان چنه جه هیلا رایداران دا نای پاروکرن یعنی داخوازم میا یکم جی او که رایدارین ترکیه ام مدفس که وی پیواجویه یعنی زلالی بده مشاندن و درباره پیواژوی دا آگاهی بده، رای گشتی بده، سازی دموکراتیک بده، امبیجن خبرکارین تندرستی، سندیکای تندرستی، لیمه خابن رای دار وانا پار و ناکن، یعنی ترکیه گله کی دوی واریدا که ماسیه او هن آگاهی انکو ام دگرن جی دروای ولات وک امبیجن جبو کو توریست ورن ترکیه جبو زیادتر هن دورین ترکیه باشتر بدن نشاندان یعنی دبیجن وان درا کمتر نخوشین هیه جبر وی دکارم ورن جبوی وان تشتاد بیجن جبر وان سدمان مخابن ام نزانن که چکاس کس هنه ین زاروک چند کسن ام نزانن چند کسنه لیبلی ترکیه جد دسته که حتی نها کدخیا زاروکا هبو درکتنا وانا دروایین که تمنی وان دبن 20 سالی دابو و این که تمنی وان 65 سالی برجورتر بون وانا درکتنا وانا کولانا کدخه بود ev xal bixuji yani ev jî tiştekî bi aboriyê ve girêdayî bû rastî jî dema ku evan kesên ku zêdetir yani di nav aboriyê de nînin ew qedexe bûn ji ber van sedeman jî dibe ku zarok hejmara wan rêjeyê wan kêmtir bê mixabin ew dane destê me de nîne lê belê di Tirkiye û Bakurê Kurdistanê em karin bêjin ku kêmtirin yani di nav zarokan de gelekî kêmin yên nexweş. Belê.
Zor spas, Dr. Halis. Dr. Bahrouz, are you still there? Dr. Bahrouz. The question was, do you know the number of cases for pediatric patients who have got COVID-19, but in particular in Rojhelat?
Fortunately, in the Rojhelat area, and also, as I know, in the central part and other part of the country, we had not such a big experience with the infected children with COVID-19. In Rojhelat, as I know, there wasn't any case to be reported as a COVID infected. But in other area, not so much people without any sign or symptoms. There was only some fever, but the IgG and IgM but raised, and because of that, they suspected to be a COVID-19 infected.
Dr. Bahrouz. I think the final question by Dr. Abdul was what I would propose to do in the interest of time. We could get the speakers together and get their emails that you could potentially write your proposition with regards to having a holistic sort of normal, what should we say, a standardized approach to COVID patients and cases in all four parts of Kurdistan, and we can address that after the Zoom meeting, if that's okay with you, Dr. Abdul. Afu. So we just need to unmute you, sorry. If you unmute your microphone.
Yeah. Sorry.
Yes.
Yes, that's very nice. It's very nice of you. That's very nice of you. If I get an email address also, I can send the manual of the SIPCA that I mentioned.
Yes. If you send one of the co-hosts a private message on Zoom with your email, we'll send you our details and we can pass it on to all four speakers, Doctor, if that's okay with you.
Thank you very much.
I believe we have a couple more questions which I believe are going to be asked via video. I think Kak Waisi had a question.
Dr. Shko, I'm going to read his question because his microphone is not really good.
His microphone's not okay,
yeah.
Sorry.
And
as karım persek bir person beborinum.
Bele.
Az dixwazim Doktor Xalis ra persek bir person li Bakurê Kurdistanê beriya qayyûma li ser şaredarî navenda tenduristî hebû bi navê Tirkî Halk Merkezê û beleş gel bêze dikir ji bo tenduristiyê wan dikir niha qayyûm tune Doktor Xalis çi difikire li ser vê yani ew hebûna yani niha şaredariyê mebûna li hemberê dewleta Türk ev polîtikayê tenduristiyê dewleta Türk ew ê vî koronayê wê sivik derbas bikirana an çi difikire Doktor Xalis ji kerema xwe bêje spas dikim.
Belê etkarim berse bidim. Niha ev birastî jî xalekî gelekî giring e haftine da jî ji bîr kir ez bînim ziman ji ber ku we bîra me xist gelekî spas jî dikim. Ev mesela şaredariyê birastî jî gelekî giring e ji ber çi jî ji ber ku gelek karûbarên ku şaredarî dike têkiliya wî bi tenduristiyê re heye yani karûbarên ku şaredarî em bêjin pakijî, hawirdorê, komkirina çopa ev hemû tişt girêda ye bi tenduristiyê re. Rastî jî li ber ku Bakurê Kurdistanê li gelek deveran qayyûm wek îradeya gelê Kurd hat tunekirin û qayyûm hat ser şaredariya ev bi neyênî bandor li ser tenduristiye gelkir ve ku ve jîhanîn ziman ew navendên tenduristiyê hirîjê hatin girtin û her wiha têkiliya şaredarê gel kut bû. Niha ger ku ev şaredarî hemû di destên ew kesên ku caliyê gel ve hat ji hêla gel ve hatbû hilbijartin di dest wan da bûye ez bawerim ku ev bandora koronayê li Bakurê Kurdistanê hewqa zêdetir nedibû. Wek mînek mesela bajarên Amedê niha hevserokê şaredariya mezin birêz Selçuk Mizraklî wek ana girtiye ew jî bijîşkekî bû hevalên me ger ku ew biya ez wê baweriyê dame ku têkiliya wî gel ew ê zêdetir baştir biya. Ew ê zêdetir di nav kolan da bi gel re rû bi rû biya. Ew ê baweriya gel zêdetir bi wî bata ew ê gel zêdetir bi wî bawer bikira. Ger ku wî tiştekî bigota gel ew ê di kirdariya xwe da di pratika xwe da zêdetir bi cîbaniya ji ber van hemû sedeman bi rastî jî ev polîtikayên em bêjin bi neyênî tesîr kiriye û niha jî yek sedema hezî mezin jî ew e ku yani ev şaredar naxebitin têkiliya wan gel qutkiriye û em bêjin baweriya gel wan nayê û ew xebat ji ber ku nayên kirin baweriya gel jî bi wan nîne جبر او خبات بزمان زكماتي جناين كريم بزمان دايك جناين كريم جبر وان همو سلمان زیاتر کرونا زیاتر لباکوری کردستانی باندورد که و افجی مخابن گلیم زیاتر نخواش کردن و جواناجی هنگشه جیان خوش دستن یعنی به توام بدیات کردن بیشم به نیمی باندور کردن. سپاس.
سپاس خوش دکتر خالص یالکaya. And Anna, the Azat, can you hear me?
Yeah, I hear you.
Can you turn on your camera, please, if you...
Okay.
Okay, thanks. Mm-hmm. If you are not allowed, you can. Yeah, okay. But, okay. Thank you.
Varbash, I think similar question to the previous participant. It's about the conditions to Dr. Khalis, who's talking from Bakur, about the conditions of detainees, including the Kurds or all the prisoners, particularly the political detainees in Kurds and other detainees. And also a question about the abuse of the lockdown by Turkish authorities against the Kurdish gatherings and demonstrations and in terrorizing the Kurdish public. If you can answer these questions, would be appreciated. If he cannot, I know I appreciate that he is speaking somewhere difficult. Thank you.
Kekalat, maybe you can repeat your question in Kurdish because
Persimmon يعني نزيكي وبرساب برينها هاتي قلتن لي از تايبت السر روشة زندانية يعني بتايبت زندانية باش تمام يعني هر كرد نكرد يعني زندانية سياسي مثلا دي چاوا رژيما ترك في لك داوني قرتنا گوشبوب كورونا يعني هاتي ناسكرن چاوا في قرتنا public يعني كوميونيتيا همو تركيا يعني همو ملتي تركيا بكارتيني بتايبت الهرمي كردا جبو دجي خوبيشاندان و چالاكيين كردا لوي هرمي يعني چاوا بكارتيني جبو ترورايز كرنا ملتي كرد تروس يعني ترساندنا ملتي كرد لوي دي اگر تكاربي برسبي بدي از سپاس اگر تنكاربي جي امزانن روش چاوا سپاس
يعني فكرة ده تيجي Türkiye gelek bile tane rastiji roş gelek yine başla yani bu anda rastiji cihanizm yani şa bereci vakta roş asri roş tendürüsti ne var balık on çün nawe deri embejin gelek on perkesan de green jibel مثلا اینکه همو کس دزانه بر وسیله‌یان ام بیشتر گله کس جهزمارا که هم گیته بون او بخوجی پرسکده که هری مزنج بر که دوام فکر اون نخوشین بکبی گرتیگه ها و گله کس بیش بر که هر تو مرجیم و درجیین تندر.
I think we've lost him, have we? Okay, I think we've lost the connection. Or is that only for me? Has everybody lost?
يعني او مجارة كهوالي مهاني زمان دوي مجارة داجي قالكي بنيني ام بيجن بكارهانين نها ام بيجن تركيا كو پیشاندان کی یان ام بيجن چاله کی وقتا کو چید به رایدار وک کودبیجن ها کرونا هیچ بروان تدبان زخم دکن و آستنگی چه دکن خداغی چه دکن لیبله یعنی جبوی پولیتیکای خو زیده تر بدن مشاندن جبوی وی بنیینی بکارتینن لیبله هم دزانن که یعنی دراستی دا نه مثلا وان نه یا کرونا مثلا وان که یعنی مافین کسین که مافی خود کار بینن وان مافا آستنگ دکن حال خوشی دما کو پیشاندان کی چیبه ایریشن کو اودکن ت کرونا ناینن برچاو لیبله د هلا فرمی داد بجن کرونا هیچ بروی وانتشتم آستندکن لیبله هر کس زانه کو تشتکی راستی دیسی ام بجن تاکی ترکیم بجی بردام دکن حال د مجلس اتحادی زاگونا خارجه هیه و او لدیجی وام خارجه بکولانه.
زور سپاس دکتر حالیس. زور سپاس. I think we have one final question from Kak Waisi, which goes to all four speakers. The question is whether they can tell us the extent to which colonial rulers or Kurdish statelessness aggravate the battle of Kurds against COVID-19. For example, the Turkish authorities prevented the Kurdish civil society organization from delivering masks and collecting donations. Similarly, the World Health Organization and the Assad regime refused to provide Kurdish administration in Rojava with PPE because it does not recognize the non-state actors. I think this question would more apply if Dr. Sherwan is around and Dr. Halis and Dr. Bahrouz with regards to the Iranian, Syrian and Turkish authorities. Dr. Halis.
Yani
Hello.
اتکارم بیا بینم زمان راستی جبر گلک یعنی او پرستکی گلکی یعنی دورو درجه براستی یعنی جبر همو وان سدمان بیشتر تکوشینا کل دیجی کرونا امدکن گلکی سیستیکی یعنی دوی واردا سیستون هی براستی گر کو دفت زیاده تر بونا آرامی هبونا و هن او وک دولت هن دموکراسی هبونا براستی لگور من باندور هاوکا زیاده تر ندبول سر گلی کرد هجماران کو کسین کو توشبه کرونا اتکت زیاده تر ندبول هاوکا مرنجی چه ندبون یعنی به مثلا هفاری و بشکری بده هفدو زیاده تر امی daha baştır امی بسر بکتنا دوی باوریه دامه مخابن شرط و مرجن ما دوی واریده و که پرسته دهانین زمان نباشه یعنی اوجی نیینی باندور سرکه سپاس
زور سپاس Dr. Halis. Dr. Sherwan, is he still here? Dr. Sherwan.
If I understand well, I will not blame the WHO because they have their restriction as they are working in Syria and they have their rules. But I will blame the countries such as Syrian government and also Turkey of playing these roles. As was mentioned, and as I also mentioned at the very beginning, that the case was confirmed in 2nd of April. We knew in 16th of April. So the Syrian government knew before us because they made the test. and they didn't tell anybody. We don't know if it was in purpose or not. The same with the shipments from Damascus or UN agencies in Damascus to here. It was not easy. I mean, we get them, maybe the first shipment was in June, and it's not coming directly to the real actor on the ground. WHO doing their best. We are in touch with them, to be honest, but always they have restriction from the Syrian government. From our side as organization, and I'm talking on behalf of 1,400 people, most of them doctors, nurses, paramedics, and also I'm sure the self-administration. We thank you for this step to put all of us in touch. Unfortunately, we are divided by borders. We are sad that we are saying our brothers in Bashur suffering while we are sitting here doing nothing. It will be really appreciated, or if we can do something or pass. We already offered this to Italy also, even though we don't have the expertise like they do, and we like this, let's say, number of staff to go to help, let's say. It's always matter of countries. This is our fate since long time. I mean, as Kurdish people, to be divided. The same was happening not only in COVID, but in other cases. In Rojhelat, 2 years ago, I think, when the earthquake was happening, the same in Suleimania, it was really very tough for us to see them, and these borders put us away and just sitting doing nothing. This is what the capitalism, let's say, or the government doing, unfortunately, to all of us. And I'm telling this because maybe, again, the situation of Rojava is very special. We are facing all type of let's say, fights. Not only COVID, is mainly we are talking about COVID situation, but it's very complicated with other things like water from Turkey, restriction from Syria, problems with the UN and Security Council. So all of these coming together. This is our fate, but we have to not surrender. We have to fight, and this is what we are believing in, and we are doing our best here.
Dr. Sherwan, thank you very much for that answer. Dr. Bahrouz, on to you finally. I think I touched on it earlier from what on the subject of what Kagwesi was saying, was that, are you finding that minorities and such as less effort being put into supplying them with equipment, protective means, testing, than the rest of Iran?
Thank you very much. As far as I know, that is for whole countries, the COVID-19 infection and the spreading, it was a disaster. The countries was not prepared for this such a big population of the patient, and on the whole, the proportion of the equipment and the hospitals and the staffs for the patients were not comparable to the what should be in actual world. But I see, as I see in the as I told you, I mentioned about the statistics that they mentioned officially in the 4 regions of the 4 provinces of the Iran, in the Rojhelat area. The equipment is not adequate, is not as much to be as, but they try to do the best for the patients, and so far they haven't seen about that only ventilator and some sort of that PPE and for ordinary people and for the people in the community and society, mask was a problem. Preparing of the mask and using that for all of the population is not very easy, and such area it is a bit expensive to obtain the mask, and it is a problem.
Zor spas, Dr. Bahrouz. Zor spas. I think that was our final question. Thank you very much to all our guests and for all those who have attended our conference. Galek Spas, Azet and Cheshazur would really appreciate people's feedback regarding this conference. I know that some people have already written some nice comments to us, and we thank you for that. We will hope to put these videos up online for people to watch later on, and we can share these videos amongst our friends and colleagues for those that couldn't make it today. And once again, thank you very much to Dr. Sherwan, Dr. Halis, Dr. Bahrouz, and finally Dr. Herisht for their very informative talks. I certainly learned a lot from it, and I'm sure everyone else has. Gelek Spas Havalan.